Hello, I am Dr. Sagar Lad, pediatric intensive care specialist working in Sahyadri Hospital at Shastri Nagar. Today's topic of discussion is bottle feeding in the babies. Do we really do it? What are its disadvantage? We all know breastfeeding is the best feeding for the babies, and that's why the breastfeeding is called as Amrut in Marathi. So usually we promote the breastfeeding to all the babies, but nowadays there is increasing the concern and increasing in the giving bottle feeding to the babies. It is so much so that we are seeing every alternate mother want to give a bottle feed to the baby. Is it really needed? Absolutely not. There are tremendous amount of complications that are associated with the bottle feeding. Generally, even if the mother is well lactating, she want to give bottle because baby is not sucking. So that is not a good thing. They express the milk in the bottle and give it. What are the disadvantage of it? They are spending a time in expressing the milk. So whenever they are giving a bottle, you get a things called as a nipple confusion. What is mean by it? The nipple between the breast and the nipple of the bottle, they get confused. As if the nipple is easy to suck on the bottle, baby prefer to give a bottle feeding. उससे क्या होता है जो मदर बेबी का बॉन्ड निकल जाता है एट दैट पॉइंट ऑफ टाइम इट इज़ लाइक अ शॉर्टकट वी आर गिविंग अ बॉटल बेबी विल टेक बॉटल एंड बेबी विल बिकम क्वाइट एंड द बेबी विल सेटल डाउन तो उससे प्रॉब्लम क्या आता है कि लॉन्ग रन द बॉटल फीडिंग इज गोइंग टू कॉज द ईयर इन्फेक्शन बिकॉज दैट मिल्क इज गोइंग टू गो डाउन टू द ईयर दे गेट रेस्पिरेटरी इन्फेक्शन वेरी कॉमन रिकरेंट निमोनिया का एक कारण बॉटल फीडिंग रहता है थर्ड चीज़ क्या रहती है कि बॉटल प्रॉपरली अगर आपने प्रिपेयर नहीं किया इज़ अ कॉन्स्टेंट सोर्स ऑफ इन्फेक्शन बिकॉज द शुगर कंटेंट इन दैट फॉर्मूला इज़ वेरी हाई एंड बिकॉज ऑफ दैट बैक्टीरिया कैन ईजिली ग्रो इवन बॉटल फीड करके रखा मिल्क तो भी उससे बैक्टीरिया ग्रोथ होकर लूज मोशन के चांसेस बढ़ते हैं उससे क्या होता है अल्टीमेटली वेट लॉस होता है वेट गेन होता नहीं है फेलियर टू थ्राइव होता है रिकरेंट बेबी बीमार हो जाते हैं So that's why we should discourage of giving the bottle feeding to the child. There are lots of people who promote bottle feeding, but I think as a medical person, whatever is the scientific evidence and knowledge show, bottle feeding should be abandoned in the babies. Second thing, what is the advantage of breastfeeding? Why it is called Amrut? When the baby is inside the tummy, they feel a pulsation of the umbilical cord. It is like a beating cord because all nutrition of the babies goes to that cord. Now when the baby comes out, when you feed the baby on the breast, especially on the left breast, they can feel the pulsation of the mother's heart. So it helps for the bonding. It is scientifically proved. If you feed the baby on the left side of the breast, they feel the mother's heart. Second thing, because of breastfeeding, they get eye to eye contact with the mother. Thirdly, they get used to the sensation of the mother so that the sensory system, nasal system, smell sensation improves. There is a contact and even a hearing, they can recognize the mother's voice. So it is a hearing can improve. So such 5 advantage has nature has given if you breastfeed the baby. So and it has been proved scientifically that the breastfeeding improves all these things. One more thing about that कि breast milk contain a milk that grows the brain. So the bottle feeding either given by the formula or a mother milk is not good. Formula feed doesn't contain a substance that will give the growth of the brain of the child. Bottle feed will increase the weight of the baby but not the brain because the substance which are producing in the milk that increases the brain growth. तो मदर के दूध से ब्रेन ग्रोथ होता है और बॉडी ग्रोथ वेट बढ़ता है फॉर्मूला से ब्रेन बढ़ता नहीं है वॉट एवर इज द सब्सटेंस वी आर पुटिंग इन द फॉर्मूला इज नॉट गोइंग टू इंक्रीज द ब्रेन ग्रोथ तो ब्रेन के लिए हमें फॉर्मूला नहीं ब्रेस्ट मिल्क ही देना है तो आप बोलेंगे कि हम बॉटल से ब्रेस्ट मिल्क देंगे तो भी फ़ायदा नहीं है बिकॉज मैंने बताया बॉटल से कितने कॉम्प्लिकेशन होते हैं इन्फेक्शन होते हैं वेट गेन नहीं होता है शॉर्ट टर्म इट इज़ नॉट देन कौन से बेबी को बॉटल फीड देना है एब्सोल्युटली नॉट फॉर द नॉर्मल बेबी और प्रीटर्म बेबी एब्सोल्युटली नहीं देना है ओनली बेबी हु हैज़ गॉट अ क्लेफ्ट पैलेट और क्लेफ्ट लीप जिनमें स्वॉलो करने में प्रॉब्लम आता है उन बेबीज़ में डायरेक्ट ब्रेस्ट फीड नहीं कर सकते स्पेशल टाइप ऑफ बॉटल आता है जो हम बेबी को दे सकते हैं That is the only advantage. The making of this video is very important because we want to learn or educate the society. Stop doing such things for the babies because you don't know the long term complication of the bottle feeding. So in India, in Indian culture, usually the bottle feed is not given, and even scientifically it is proven there is lots of advantages giving in a breastfeeding, not giving a bottle feeding. So say no to a bottle feed. If you have any question or the problem to this, we are here at a Sahyadri Hospital to give you all your answer. We are available. You can contact at a given link below. We will help you out. Thank you.